Hi everyone, I'm Emily and I am the Senior Program Director at the Cumberland YMCA. I typically work over at the Riverside facility, but over the next several weeks I am going to be presenting lessons on tobacco education, and we're going to be talking about how tobacco affects you, affects your baby and your family, and I'm going to reinforce that you can get help and you can quit. So today we're going to talk about the dangers of smoking and that smoking is no joke. So I have kind of a riddle here to get us started. So how many tobacco company executives does it take to turn a light bulb? Answer is none. So they want you to be in the dark. I know that was really cheesy, but it's true. They want you to be in the dark and they don't want you to know all of the dangers and all of the side effects and negative effects on your body, your family, your health that smoking can create and cause. So I am going to be using lots of different resources and references. So as you can see, I have posters behind me that we're going to look at. I also have all of these pamphlets, some pictures, and we also have a spin game here that we're going to take a look at too. So to get started, we are going to talk about how tobacco affects your body specifically. So ingredients found in tobacco smoke are active and they start to affect the body as soon as they enter the system. So when a person smokes, the smoke enters the lungs and the chemicals start to travel through the body. So cigarettes contain over 7,000 chemicals. That's a lot of chemicals. And 70 of those chemicals can cause cancer. So that's a lot. The chemicals are really potent in that they have the ability to affect rapid changes in the body functioning. So something that's really important to remember, smoking and using tobacco can affect your entire body. And we're going to talk about that. Look at this poster. So not just your lungs, your entire body. So many different things. So I also have this book here called The ABCs of Smoking. And I actually learned a lot from this. You know, I think you always hear that smoking's not good for you, smoking is bad, but this goes through every letter of the alphabet, or almost every letter, and gives you a health consequence associated with smoking. And it does have pictures with it as well, which some of them are kind of graphic, but I do think it's important to look at so that you can really see the big picture and see everything that's associated. So we're going to talk about the brain and how smoking and tobacco use can affect the brain. So nicotine is a drug in tobacco, and it changes the chemistry in the brain so that you crave more nicotine. And that's what can cause the addiction. Those chemicals and changing the chemistry in your brain is what causes addiction. You know, no one really goes into something thinking, oh, I want to get addicted or I want to become addicted. And a lot of times people can think, I'm not going to become addicted. No way, I can quit anytime I want to. But this is really showing you that there is a chemical in cigarettes that do cause addiction. So it's something that can, it can do it on its own, without you even trying. So going back to this ABCs of Smoking book that I have here, we're going to go ahead and take a look at some of the different things. So we have asthma. I'm just going to list some of them. Asthma, bladder cancer. You can see the pictures down here. Bronchitis, burns, cancer, cardiovascular disease, COPD, drug interference, emphysema. You can see all of these images. Esophageal cancer, erectile dysfunction, fetal damage, gum disease, heart disease, impaired athletic ability, increased severity of diseases, infertility, kidney cancer, also lung cancer. This is a picture here, a really graphic image of, a lung of someone that has lung cancer. And you can just see that damage there that smoking causes. And we also have a statistic here. Tobacco use kills one person every 6 seconds. That's a crazy statistic. That's scary. 1 every 6 seconds. There are also monetary costs associated with smoking, which we'll look at here in a little bit. There's also oral cavity and oral cancer, osteoporosis, pancreatic cancer, premature aging, secondhand smoke, which we'll talk about too, stroke, suppressed immune system, vision impairment, yellow teeth and nails, and young addiction. So this is just kind of getting us started here, ABCs of smoking, and those are a lot of different side effects. So that ties into our poster here. How does tobacco affect your body? Smoking harms nearly every part of your body. Again, people mostly think that smoking is tied into lung damage and lung cancer, but it's really so much more than that. Just from going through those ABCs of smoking, you can see the big picture, how many different things are associated, negative effects with smoking. So we talked about how it can change your brain, that nicotine can affect the chemistry that causes you to crave more and become addicted. And we'll talk about, how that can affect your family. That addiction can affect your family and your children. So looking at the heart, nicotine in cigarettes, cigars, and smokeless tobacco narrows blood vessels, and that forces your heart to work harder and raises blood pressure. So eyes and ears, smoking can cause problems with your eyesight, so it can make your eyesight worse or bad. If it's not bad to begin with, it can cause it to become bad and even lead into blindness. And studies now show that smoking is also associated to hearing loss. So lungs, of course, we know, most people do know that cigarette smoking causes lung cancer and can make you cough and even cause bronchitis and emphysema. So other organs of your body, smoking increases the risk of cancers in the bladder, the kidneys, the liver, colon, stomach, blood, and even reproductive organs. So, and then muscles and joints, smoking keeps oxygen from reaching your muscles, which can make you feel weak. So it can make you feel bad in general. It can make you feel bad throughout your pregnancy, and it can make exercising and living a healthy lifestyle with exercise included very, very difficult. So to protect your body, it's best to say no to tobacco products, because you can see how many different areas of your body just from this that smoking cigarettes really affects. So we're going to go ahead and move on to looking at how tobacco can affect your pregnancy. So I have this poster behind me here. It's called What Goes in Your Body Goes in Your Baby. And I have been teaching our prep program in a lot of the local high schools over the past year or two. And this poster I have seen in different forms in all the different health classes. And I thought, wow, this is so important for people to know that it not only affects you, but it also affects your baby while you're pregnant. So we're going to go ahead and kind of taking a look at this. We're going to look at 10 best reasons to not smoke while you're pregnant. And this is kind of tied into a pamphlet, a brochure that I have here. And it talks about how you can help yourself and help your baby. So helping yourself by not smoking will help your baby, even after pregnancy too. So you can totally do it. Number one, many women do actually stop smoking before they become pregnant as a preparation, and they also stop smoking while they are pregnant. But something that's really important to remember is you need to talk to your healthcare professional with these decisions, because they can provide you guidance and make sure that you're quitting in a healthy way for you and your baby. So if you quit, your baby of course does too, because we said here, looking at this poster, what you what goes in your body also goes in your baby. So when you smoke, those cigarette chemicals reach your body and they keep your baby from getting the food and oxygen that it needs to grow. So it is best to quit before you're pregnant, but quitting anytime while you're pregnant will help. So you'll have a healthier pregnancy. Women who smoke have a higher risk of bleeding and miscarriage. So babies might be born too soon, and if you quit, your baby is likely to be born at the right time. Your pregnancy might also be easier. So quitting will help you breathe more easily and cough less. You have more energy to carry your baby's extra weight, and food will taste better. So if food tastes better, you're more likely to be able to eat healthier foods throughout your pregnancy, which is important for the growth of your baby. Your baby will be a healthy weight. So babies born to mothers who smoke during pregnancy actually weigh less than other babies do. So with that is a problem because smaller babies tend to get sick more often and they are more likely to die within the first year. So if you quit, your baby is more likely to be a healthy weight whenever they're born. Quitting will also help lower the risk of SIDS. So SIDS stands for Sudden Infant Death Syndrome. And smoking during pregnancy actually triples your baby's risk of SIDS. So if you quit, your baby has a lower risk. Your baby is also less likely to be stillborn if you quit. So beyond that, smoking affects breast milk as well. So of course, quitting will help your breast milk become chemical free. So chemicals in cigarette do enter your breast milk, and the nicotine can cause restlessness, vomiting, and diarrhea. So smoking increases your baby's risks of SIDS. So in comparison to breastfeeding, the nicotine and the smoking in that. And smoking might also reduce the supply of breast milk too. So by quitting, you'll also protect your baby from secondhand smoke. Infants are more likely to get sick if their parents smoke, if they are exposed to that smoke. And if you quit, your baby will be less likely to have colds, bronchitis, ear infections, allergies, and even asthma. So, and then super important, you'll live to see your child grow. Of course, we look through the ABCs of smoking and looked at this poster a little bit, and you can see all of the negative health effects that smoking has on your body, including cancers. So quitting helps lead to a healthier path in life and can help you live longer and live healthier so that you're around for your baby and you're around and able to take care of your child or children and your family in general. So we're going to go ahead and move on to not only talking about how smoking directly affects your pregnancy and your family, the health effects, we're also going to talk about the money associated with smoking as well. So I have a pamphlet here called The High Price of Smoking, and we're going to talk about tobacco and money and what that really looks like. You can see how much smoking really costs, and not really direct costs, also indirect costs that you might not necessarily think of. So we're going to go ahead and look at how much on average smoking a pack of cigarettes costs. And we're going to look at what you could spend that money on instead. And we're also going to look at some of the hidden costs that you don't necessarily think about. So looking at the price of a pack here. When people start smoking, they don't usually think that they will smoke a lot. But again, we talked about that nicotine and we talked about the cravings and the addiction. So people who smoke regularly do smoke about a pack a day on average. And a pack of cigarettes can cost from $4 all the way up to $10 or more, depending on where you live. But on average, we'll go ahead and say for this that cigarettes in your area, in our area, is on average $7 a pack. So to kind of look at that here, we're going to look at $7 a pack times 7 days. So that's 1 week. That's $49 a week. $49. So multiply that by 4 weeks, looking at a month here, that's $196 a month. And then multiplying the weekly cost by 52 weeks, so we're going to look at a year, that's $2,540 a year. So if you smoke 2 packs a day, that's more than $5,000 a year. So that's just your hard-earned money going up in smoke. You know, that's so much money. And we can look at that in a different way, what you could buy with that money. So in 1 week, you could save enough money to pay for any of the following. You could pay for 2 movie tickets, popcorn, and a soda. You could also pay for a couple large pizzas with everything on them, all of the toppings, or a new t-shirt. And that's just 1 week. 1 week. In 1 year, you would save enough to buy a new mountain bike, a down payment on a car, the latest computer, or even a whole bunch of new clothes. And in 20 years, I know that seems like a long time, but listen to this. You would have enough to make a down payment on a house. You could buy a car or even help pay for your kids' college education, which is very expensive. So that's, that's a lot of money, a lot of different things that you could buy instead of those packs of cigarettes. And we have to look at the indirect costs as well. So things you might not necessarily think of spending money on that you're most likely going to have to spend money on smoking. So looking at teeth cleaning, we talked about how oral health is a side effect of smoking. So the yellowing of the teeth. To get rid of those yellow and brown tobacco stains, on average, the cost of that cleaning would be $75. Healthcare, you're going to need the extra doctor's visits because of the colds, asthma, bronchitis, pneumonia. On average, that's $100 per visit. Hospital bills, looking at lung cancer, the average cost of a surgery, radiation, and chemotherapy is $50,000. So in life insurance, smokers pay more. Average cost is up to 3 times as much. So of course we all know that raising a family can be expensive. Babies are expensive. So we have to make sure we have money that we can take care of them. We have to think of things like that as well. So that's a lot of money. All right. So moving on here, I have a couple more things that I want to talk about today. Other ways that tobacco can affect your family. Talking about addiction, when you're at work and you smoke, you might have to take smoke breaks. Even if you don't think that you necessarily want to or would need to, again, the nicotine affects the chemistry in your brain so that you crave more nicotine. You're going to want that. And even if you don't want to, it's going to give you side effects that in the downtime when you're going through that withdrawal. It's going to cause moodiness, irritability. So you might have to take those smoke breaks. And of course that can affect work productivity. So jumping out of the mindset that you're in when you're at work to go take those frequent breaks, it's going to be so much harder to get things done, get things accomplished. And of course, that can lead to a stress in your workplace. It can lead to job loss if there isn't productivity like there should be. And even if it doesn't lead to job loss, it can cause poor work performance, especially where production is calculated as units per unit time. Constant breaks also cause an employer to feel that they pay for undeserved hours, and it causes a feeling of employees stealing employers' times. So employers think that they're not really getting as much as they should because these employees are taking these constant breaks rather than working. So, and of course we talked about children and families can be expensive, and paying to support those children can be expensive. So losing your job can cause a burden on all of that. And this addiction, smoking leads to dependency. And smokers can become irritable and unable to relate well to people around them. And, with that addiction, with that dependency, if you're not taking those smoke breaks, it can have a negative stress on your family. By the moodiness caused by skipping the habit, it can cause parents to be irritable and make unreasonable demands upon their children. So those are all things to think about in relation to your family as well. So just to kind of wrap things up here, looking at health, I have a spin game. And this game is meant to be played in person with many people, but you can kind of take a look at what we have here. Smoking is, smoking's a gamble that really no one wins. No one wins here. So we can spin this wheel and you're going to play and lose. You're going to see all of the negative effects that smoking has on your body and your health. So we just landed on fetal damage. That's something that we talked about, a negative health effect. Also high blood pressure, premature aging. We talked about those wrinkles. We talked about the yellowing of the teeth, gum disease. We talked about oral problems associated. So, and influencing others to smoke. That ties in with your family as well. Children, if they see their parents smoking, if they see their family smoking, it can lead into addiction and smoking for them as well. So that's something very important to think about. All of those health effects that we talked about for not only you, but also your baby and your pregnancy today. So thank you so much for listening, but before we wrap up for the day, I do want to go over a plan for how you can quit. So I have right here just a pamphlet that kind of lays out some tips for quitting. So what to do is kind of lay a plan out for yourself, because if you have a plan, it is so much easier for you to kind of go the direction that you want to go, so you can stick to that plan. So quitting tips here. Pick a day to quit and stick with it. Throw out all of your cigarettes. Drink 6 to 8 glasses of water a day. Chew gum, carrots, or celery. Keep your hands busy. Knit a baby blanket. Make a baby album. These are all things you can do, if you're pregnant or with your families. And ask for support from your families, your friends, and your healthcare provider. We talked about it's important to make sure your healthcare provider is in the loop, especially in regards to pregnancy, so that they can kind of help you with that plan to make the best plan that's suitable for you as an individual. And if you can't stop, try to cut back. Think about your growing baby and think about your family. So, thank you guys again so much for listening in. And this video was presented by the Cumberland YMCA through a grant from the Allegheny County Health Department and the Maryland Department of Health Patch. Great. Thanks, guys.